Good morning to all. So now we will have a discussion on a very small topic and a very important topic also, the signs in the larynx is concerned. Okay, so we have already dealt with the signs in the ear, we have already dealt with the signs in the nose. Now we will deal with the signs in the larynx is concerned. Okay, larynx and pharynx. Okay, so what are the important signs? We know that the signs are very important while we face our entrance exams. So what are the important signs which we come across in our ENT, which is important for your entrance exams, important for your practical exams? So coming on to the first one, let's see this picture, let's see this PowerPoint. So what is this sign called as? What is this one? What is this sign called as? What is this one? See here, what is there pointed in the arrow? This is something like a shape of our thumb. Okay, the shape of our thumb. This is called as thumb sign. See here, something like our thumb. Okay, so it's called as thumb sign. So thumb sign is seen in which condition? Thumb sign is seen in epiglottitis. Very important MCQ. Okay, thumb sign is seen in epiglottitis. So thumb sign, just imagine the picture again, see this picture again, see this arrow which has been marked. So this will go to a point of thumb impression. Okay, thumb sign. So thumb sign is seen in epiglottitis, which is caused by which organism? It's caused by Haemophilus influenza type B. Okay, so this is a very important one, the thumb sign. Okay, so coming on to the next important MCQ, what is there in this X-ray again? Now this is a child presenting with a cough, presenting with a continuous episodes of URI again and again with a cough which is there, and the child is very small, something around 6 months to 2 years of age, and this was the X-ray picture. This is the X-ray picture. What could be the diagnosis now? What could be the diagnosis? What is this here? See here. Okay, here we could see something narrowing in this area. That is called as steeple sign. Steeple sign. It's something like the steeple. Okay, steeple sign, which is otherwise called as pencil tip sign. Steeple sign or the pencil tip sign seen in our ENT. It is seen in which condition? It is seen in acute laryngotracheobronchitis, that is otherwise called as croup. Acute laryngotracheobronchitis or the croup, we could see some steeple sign or a pencil tip sign. This is a very important image based MCQ is concerned. Okay, these two are very important. One is a epiglottitis, that is a thumb sign, other is a steeple sign or a pencil tip sign. Okay, the next one again which is very important is, see this picture actually. Here the patient gets a swelling while doing a Valsalva maneuver, swelling on the lateral aspect of neck. And this is an imaginary picture. We could see the larynx. There is an outpouching from the larynx which is going out up to the thyroid membrane is concerned. See here, there is an outpouching from the larynx which is just going out, breaching the thyroid membrane and comes out. Okay, and when the patient performs an Valsalva, we could see a swelling in the lateral aspect of the neck. What is the condition called as? What is the condition called as? A trumpet blower or a glass blower or whatever. Those who uses their voice for a long period of time, they will get a swelling in the upper 2/3 of the neck, and one while doing a positive pressure, that while doing a Valsalva. Okay, that condition is called as laryngocele. Okay, so what happens in a laryngocele? What is the sign seen in laryngocele? In laryngocele we have a sign which is called as Bryce sign. Bryce sign. So what happens in a Bryce sign is, say as the picture is shown above previously. One second. So this is our larynx. As we have seen the picture, we could see there is an outpouching from this area. There will be outpouching from this area which has come out and which has almost breached up to the thyroid membrane also. Right. So what happens whenever the patient does a Valsalva, the swelling increases, and then once he releases, the swelling will decrease. Okay, as the swelling decreases, that will produce some gurgling sound in the neck is concerned, and the gurgling sound is called as Bryce sign. The gurgling sound, that is called as Bryce sign. Okay, clear? So we have two important signs, the Bryce sign which produces a gurgling sound in a laryngosyle, and one more condition in our ENT which produces a gurgling sound again is, that sign is called as Bokeh sign. So Bokeh sign is seen in which condition? Bokeh sign is seen in Zenker's diverticulum. Zenker's diverticulum. Again, we know that what happens in a Zenker's diverticulum, there occurs a say this is a thyropharynges. Okay, this is a thyropharynges. And this is a cricopharynges. Okay, there occurs a weak area between the thyropharynges and cricopharynges. So there will be an extra outpouchings. There occurs an extra outpouching or a false tract in the area of Killian's dehiscence. That is called as Zenker's diverticulum. Okay, again what happens now? The food which has been taken, the food goes inside, but now it enters through the false tract, and then it gets stagnated here, and then the patient gets an episode of regurgitation, some belching sounds, so that in that episode the food comes out and enters into the normal tract. Right. So this as the food gets stagnated in the false tract, and as it comes into the normal tract, it again produces a gurgling sound, which sign is called as Bokeh sign. Clear? So two conditions in ENT which produces a gurgling sound, one is a Bryce sign, other is a Bokeh sign. And two conditions in the ENT which are infections in the pediatric larynx, one is a thumb sign, other is a steeple sign or a pencil tip sign. Okay, so these are the very important MCQ is concerned. Remember, Bokeh and Bryce, don't get confused with it. Bryce sign laryngosyle, Bokeh sign is seen in Zenker's diverticulum. Okay, so coming on to the other conditions in the pharynx is concerned. In the pharynx, we have two other important signs, which is called as Irvine sign. What happens here? Here, while we just press the tongue depressor, okay, when there is an active infection over the tonsil area, see an active infection over the tonsillar area, when we just press over the tonsil area, we could see some pus coming out. Okay, then there seems to be some squeezing of pus. The pus comes out when we just touch the tonsillar fossa with a tongue depressor. Okay, we are not just pressing it with our hand, we are just pressing it with our tongue depressor, so that the pus usually comes out. That seen in Irvine sign, seen in tonsillitis. Coming on to the next important sign, the Bokeh sign. So what is meant by Bokeh sign? Again a very important sign, Bokeh sign. So Bokeh sign is nothing but, we know that when we just press over the larynx, and we just move like this, when we just bend down, press the larynx, move ahead, we could see that the larynx goes and rubs around the vertebra, produces a clicking sound, right? When we just move it, we could hear a clicking sound. Okay, so what happens here is, so assume that, okay, this is a thyroid cartilage, this is a cricoid cartilage, and here we have a vertebral segment. Okay, so when we just press over the thyroid cartilage or the cricoid cartilage, when we just press over, we could feel that the cricoid or the thyroid cartilage is rubbing over the vertebra, and that produces a click sound, which is called as laryngeal crepitus. What we call it is a laryngeal crepitus. Okay, in some conditions, this laryngeal crepitus, whatever we discuss, will be absent. That is called as Bokeh sign is absent. So this Bokeh sign is nothing but when we just move on ourselves, okay, we could feel for a laryngeal crepitus. If this laryngeal crepitus is absent, that means the cricoid cartilage is not rubbing over the vertebra. So what condition in which the laryngeal crepitus will be absent? Either there could be something like a tumor in this region, that is behind the cricoid, between the cricoid and the vertebra, there should be something, right? Either there should be some tumor, okay, in the post cricoid region, that is called as post cricoid condition. Post cricoid carcinoma. Okay, or say if there is an infection in this retropharyngeal segment, there is some infection in the retropharyngeal segment, again there will be absence of laryngeal crepitus. Okay, so laryngeal crepitus is absent in two conditions, very very important, that is Bokeh sign is negative in two conditions. What are the conditions? One is remember simple. So now when we just move it over, the cricat has to go and rub over the vertebra. Okay, so if it's not rubbing over, then assume that, think that there is something between the cricat and the vertebra. Okay, so what are the conditions which can occur there? Either it could be a post-cricoid, that is behind the cricoid, that is either there could be any post-cricoid condition, post-cricoid malignancy, okay, or either there could be an infection in this retropharyngeal segment, either a retropharyngeal abscess. Okay, these are the two conditions in which the laryngeal crepitus is absent. That is Bokeh sign is negative. Clear? Very very important thing. Bokeh sign. Have in mind, just feel the laryngeal crepitus. Make the patient bend down and move the larynx so that we can feel for the laryngeal crepitus. That is Bokeh sign. Okay. Bokeh sign absent is seen in which condition? Very very important one. Post-cricoid carcinoma. Another is retropharyngeal abscess. Okay. So coming on to the next sign, which is called as Cavalier-Jackson sign. Cavalier-Jackson sign. So what does this indicates? Cavalier-Jackson sign means, say when I am just putting an endoscopy now. Okay, we could see this is the vocal cord. This is the vocal cord. Okay, so we can see that this will be the pyriform fossa. So this and this will be the pyriform fossa. Okay, we know that normally when the esophagus is fine. Okay, so for a normal person, if this esophagus is fine, there won't be any secretions in this pyriform fossa. Okay, but say if the esophagus has some obstructed foreign material, if there is some foreign body in the esophagus, something like a chicken bone or a mutton bone or some carcinoma or whatever, okay, some foreign body in the esophagus, because of that the secretions are not getting swallowed inside. Okay, so what happens here? There occurs as pooling of secretions in the pyriform fossa. Okay, there occurs some pooling of secretions in the pyriform fossa, right? So if there is a pooling of secretions in pyriform fossa, that to both sides, in both sides pyriform fossa, have in mind that sign is called as Cavalier-Jackson sign, and it is seen in which condition? It is seen either in cases of any foreign bodies in the esophagus or any tumors in the esophagus, so we need to have in mind. Okay, so these are the signs which we come across for our entrance exam is concerned. Very very important. So starting with the epiglottitis, the thumb sign, the steeple sign or the pencil tip sign, okay, the Bryce sign, the Bryce sign, okay, and we have Cavalier-Jackson sign, the Bokeh sign, and the Irvine sign in tonsillitis. These are the very very important exam point of view is concerned. Hope this will be very useful for you for your entrance exams and for your understanding the ENT is concerned. And for more videos, just go back to our ENT app. The link will be shared here. You can see all my videos, the entire set of this as a masterclass series. You can have an image based session in that app also. It will be very useful for you. Hope it will be helpful. Thank you. Have a good day.